Milton H. Erickson, the innovator of hypnotherapy, a documentary biography. Chapter 1. Beginnings and Early Life. Milton Highland Erickson was born on December 5, 1901, Nevada, in the mining community of Orem, Nevada, into a family where hard work and resilience were deeply valued. Growing up as the second of 9 children in a modest household, his family eventually relocated to Beaver Dam, Wisconsin, where the rhythms of farm life and the challenges of rural existence instilled in him an enduring determination. From an early age, Erickson's world was marked by obstacles that would later forge his unique approach to the human mind. He struggled with dyslexia, tone deafness, and color blindness, conditions that created difficulties in formal education and communication. These early challenges demanded that he develop acute observational skills and an appreciation for nonverbal cues, attributes that became the cornerstone of his later therapeutic methods. His early experiences in a one-room schoolhouse in Lowell, Wisconsin, exposed him to an educational environment that was as rustic as it was intellectually sparse. Yet these humble beginnings laid the groundwork for a lifelong pursuit of knowledge and human connection. Chapter 2. Trials, Transformation, and the Battle with Polio. At the formative age of 17, Erickson faced perhaps his greatest physical challenge when he contracted polio, a disease that swept across communities with little mercy. The crippling effects of the illness left him paralyzed, a circumstance that many doctors believed would permanently confine him to frailty. However, rather than succumbing to despair, Erickson embarked on a journey of transformation. During the long months of recovery, shackled to a bed and confined by physical limitations, he discovered the power of self-observation and the intricacies of his own body. He began experimenting with what he later described as body memories, using the remnants of past muscular activities to attempt to regain control of his paralyzed limbs. This process, fraught with painful trial and error, not only allowed him to walk again with the aid of a cane, but also instilled in him profound understanding of the connection between mind and body. The adversity he experienced became a catalyst for his future work, teaching him that limitations could be overcome by tapping into the deeper reservoirs of the unconscious. Erickson's struggle with polio did more than challenge his physical being. It reoriented his entire perspective on human potential and the capacity for healing inherent in every individual. Chapter 3. Education and the Emergence of a New Perspective. Despite early setbacks, Erickson's academic journey was marked by intense personal commitment and unconventional methods of learning. He enrolled at the University of Wisconsin, where his passion for psychology intertwined with his burgeoning interest in medicine. It was here that Erickson earned a bachelor's degree in psychology in 1923, and later a Doctor of Medicine in 1928. His experiences in higher education were not just academic milestones, but they also shaped his belief that every individual harbored an inner wellspring of strength and creativity. In an era when rigid educational paradigms prevailed, Erickson's own learning disabilities forced him to think outside conventional boundaries. Early experiments with hypnosis, influenced by the work of Clark Hull and other pioneers in the field, marked the beginning of his lifelong inquiry into the mysteries of the subconscious mind. His innate curiosity and personal struggles converged to produce a new perspective on the process of healing, one that would later revolutionize the field of psychotherapy. Chapter 4. The Dawn of a Revolutionary Career in Psychiatry. Upon completing his education, Milton H. Erickson ventured into a career that defied convention and reshaped the world of mental health, beginning his practice in Eloise, Michigan, and later assuming roles in various psychiatric institutions, including a prominent position at Wayne County Hospital in Michigan. Erickson quickly gained a reputation not as a conventional psychiatrist, but as a creative innovator in the realm of clinical hypnosis. Early in his career, his encounters with patients revealed the limitations of traditional approaches to mental illness. Instead of relying solely on the standard protocols and direct commands that characterized the hypnosis of his time, Erickson began to observe and experiment with the subtleties of human behavior. He discovered that the unconscious mind was not a repository of repressed thoughts waiting to be unearthed, but a dynamic system capable of creative problem-solving. His early work involved experiments with inducing altered states of consciousness, investigations into phenomena such as hypnotically induced color blindness and deafness, and the observation of micro-expressions and nonverbal cues that could offer clues about a patient's emotional state. This period of experimentation laid the foundation for what would emerge as a new paradigm in psychotherapy, one that placed the unconscious mind at the center of the healing process. Chapter 5. Pioneering Hypnotherapy and the Art of the Utilization Approach. Erickson's pioneering contributions to hypnotherapy set him apart from his contemporaries. Is eschewing the authoritarian and commanding techniques common to early hypnotic practices, he championed a method based on gentle guidance and indirect suggestion. His approach, often characterized as the utilization method, was rooted in the belief that every element within a patient's behavior, be it resistance, symptoms, or even the minutest twitch, could be harnessed as a tool for therapeutic progress. Rather than viewing resistance as a barrier to be overcome, Erickson saw it as an integral part of the therapeutic process that, if acknowledged and utilized, could facilitate change. His unique methods included the use of storytelling, metaphors, and indirect communication techniques that allowed the patient's unconscious mind to internalize suggestions in a natural and unobtrusive manner. In one well-documented instance, Erickson addressed a patient's deep-seated fear by weaving a tale of a resilient cactus thriving despite harsh conditions, a metaphor that resonated powerfully on an emotional level and ultimately led to a breakthrough in treatment. Through such innovative techniques, Erickson demonstrated that healing could be achieved by aligning therapeutic interventions with the individual's inner life, rather than imposing rigid, externally derived treatments. Chapter 6. Literary Contributions and the Legacy of a Master Clinician. Beyond his clinical practice, Milton H. Erickson's influence permeated the fields of psychology and psychiatry through his extensive writings and teachings. His numerous publications, case studies, and recorded therapeutic sessions offered invaluable insights into the workings of the human mind. In his writings, Erickson elaborated on the principle that the unconscious mind plays a crucial role in problem-solving and personal transformation. His work laid the theoretical foundations for what later became known as brief therapy and strategic family therapy. His ideas also contributed significantly to the development of neuro-linguistic programming, a field that draws heavily on his techniques of indirect suggestion and the utilization of a patient's existing experiences. Erickson's literary contributions are characterized by their clarity, compassion, and a deep respect for the unique narrative of each human life. His clinical anecdotes, rich with vivid detail and unexpected insights, continue to serve as a source of inspiration for therapists, counselors, and medical professionals around the world. Moreover, his practice emphasized the importance of tailoring therapeutic interventions to the individual, rather than relying on one-size-fits-all solutions, a legacy that remains central to modern psychotherapy. Chapter 7. The Role of a Teacher and Mentor in Transforming Therapy. In addition to his clinical brilliance and innovative methodologies, Erickson was renowned for his role as an educator and mentor. Throughout his career, he trained a generation of psychotherapists, who would go on to further develop and refine his techniques. His teaching extended beyond the confines of academic lecture halls. It was an immersive experience characterized by live demonstrations, case discussions, and personal interactions that revealed the subtleties of his approach. Erickson's seminars and workshops were marked by a participatory style, where he encouraged his students to observe, question, and ultimately harness the power of the unconscious mind in their therapeutic practices. He believed that the art of healing was as much about intuition and empathy as it was about scientific rigor. Under his tutelage, complex therapeutic concepts were rendered accessible, and the seemingly mystical aspects of hypnosis were demystified through careful observation and guided practice. His influence as a teacher helped to cement his reputation as not only a clinical innovator, but also a compassionate guide, whose insights continue to inform contemporary therapeutic practice. Chapter 8. Later Years, Challenges, and the Enduring Impact. As Erickson progressed in his career, his contributions continued to evolve in scope and depth. Despite the physical limitations that had marked much of his early life, he maintained an active and engaged practice well into his later years. His later work reflected a deepening of his original insights, with an increased emphasis on the interplay between language, perception, and the unconscious. Erickson's later years also saw him confront ethical and philosophical questions about the nature of therapy, the responsibilities of the healer, and the profound mysteries of human existence. Even as advances in technology and the growing influence of biomedical approaches to mental health reshaped the landscape of psychiatry, Erickson's methods endured as a testament to the power of personalized, empathetic care. His pioneering techniques have left an indelible mark on the fields of clinical hypnosis and psychotherapy, influencing treatment modalities and inspiring countless practitioners to explore the untapped potential of the human mind. The establishment of organizations such as the American Society for Clinical Hypnosis, and later the incorporation of his methodologies into the curricula of various therapeutic training programs, attests to the lasting impact of his work. Erickson's legacy is carried forward by a tradition that values intuition, creativity, and a profound respect for the individuality of each human experience, a tradition that continues to shape the way therapy is practiced around the globe. Chapter 9. Reflections on a Life of Innovation and Healing. Milton H. Erickson's life story is one of transformation, a journey from personal adversity to the creation of a new, humanistic approach to mental health care. His early encounters with physical limitations and learning disabilities could have easily defined a life of quiet resignation. They ignited a passion for discovery and a relentless drive to uncover the underlying strengths hidden within each person. By transforming his own challenges into sources of insight, Erickson not only reinvented the practice of hypnosis, but also reimagined the potential of psychotherapy as a means for genuine, self-directed healing. His methods, which emphasized indirect suggestion, utilization of the individual's unique experiences, and creative problem-solving, broke new ground in the understanding of the unconscious mind. Through his clinical innovations, literary contributions, and transformative mentorship, Erickson reshaped the very fabric of psychotherapeutic practice. He demonstrated that healing was not the exclusive domain of rigid procedures or dogmatic frameworks, but rather an art form that required empathy, flexibility, and a deep appreciation for the complex tapestry of human experience. Chapter 10. The Enduring Legacy and Influence on Modern Therapy. Today, the influence of Milton H. Erickson is evident in a wide range of therapeutic disciplines. His pioneering work laid the foundation for brief therapy, strategic family therapy, and neuro-linguistic programming, among others. Practitioners around the world continue to draw on his principles of indirect suggestion, the utilization approach, and the creative engagement with the unconscious mind. His belief that every individual possesses inner resources for healing continues to inspire a more personalized and compassionate approach to therapy, a legacy that has transformed clinical practices and enriched the lives of countless individuals seeking help for mental health challenges. In educational settings and clinical training programs, Erickson's techniques are studied not merely as historical artifacts, but as dynamic, living tools that can be adapted to meet the evolving needs of patients. His work reminds clinicians that the art of healing lies in forging deep connections with clients, understanding the subtleties of their experiences, and encouraging them to tap into their own innate capacities for change and growth. The story of Milton H. Erickson is a testament to the transformative power of resilience, innovation, and an unwavering belief in the potential embedded within every human life. His contributions continue to reverberate across the fields of psychology and psychiatry, inspiring both established professionals and new generations of therapists to view challenges not as insurmountable barriers, but as invitations to explore the profound depths of human capability and the endless possibilities for healing. Epilogue: A life transcending limitations. Milton H. Erickson's biography is more than a chronology of personal milestones and professional achievements. It is an enduring narrative of human courage, innovation, and the relentless pursuit of healing. From his humble beginnings in a small mining town to becoming a seminal figure in modern psychotherapy, Erickson transformed personal adversity into a wellspring of insight and therapeutic creativity. His legacy lives on in the countless lives he touched, both directly through his clinical work and indirectly through the ongoing influence of his ideas. In a world continuously seeking improved methods for healing and understanding the human mind, the story of Milton H. Erickson stands as a reminder that even the greatest obstacles can be catalysts for profound innovation. His methods, grounded in respect for the individual and an unwavering belief in the potential for change, continue to shape the landscapes of mental health care, providing hope and inspiration to all who seek to overcome their own limitations. His life, a tapestry woven from threads of struggle, discovery, and compassionate healing, remains a beacon for those who believe that true transformation is not only possible, but lies within the depths of every human being.